Hi, I'm Jackie Thelian and welcome to Key Coding Tips. Today we're going to talk about how to appropriately select the additional 7th character extension for ICD-10 codes. One of the most notable changes in ICD-10 is the fact that many of the codes now include 7 characters. It does take a little getting used to. However, as with ICD-9 codes, each of those additional characters give us a little bit more information about the sign or symptom, the disease, the illness, or the injury. Think about how this impacts data entry. Now not only do you have to enter additional characters, you will also have to keep your hands not only on the number pad, but on the entire keyboard, since ICD-10 codes are both alphanumeric. The first digit or character is always alpha. The second digit or character is numeric. However, the 3rd through 7th digits or characters can be either alpha or numeric. Fortunately, these are not case sensitive. As with ICD-9, we still have 3-digit categories, and in ICD-10, we also have some valid 3-digit codes. Subcategories are 4 to 6 characters and describe further the etiology, anatomical site, and the severity of the condition. The 7th character extension will provide additional information about the diagnosis. And here we can see an example of how the code is broken down. The first 3 characters indicate the fracture of the neck of the radius, identified by S52, which is our category. The additional 3 characters alert us that this is a displaced fracture, identified with the 131, and the 7th character extension lets us know that this is the initial encounter for a closed fracture. The 7th character is a new concept in ICD-10, but it happens to be one of the most important concepts to consider. The 7th character always needs to be in the 7th character position. It sounds easy enough. However, many of the ICD-10 codes do not include a 4th, 5th, or 6th character. In those cases, the way we would code would be to place an X as a dummy placeholder to hold the place of those missing characters. Let's look at an example. As we can see, category 035, maternal care for known or suspected fetal abnormality and damage, requires a 4th character. We see that up in the left-hand corner right before the code numbers where we have the checkbox and it says 4th. Once we move down and go ahead and select that 4th character, if 0, which is what we're selecting here, we see the prompt to append the 7th character. That's that blue box that's in front of the code selection. And not only does it prompt us to use a 7th character, it has that check X 7th, which alerts the coder that dummy placeholders in this case would be required. So here we would append 2 dummy placeholders of X before appending the 7th character. And we can see our final code selection would be 035.0 XX for the 2 dummy placeholders and our additional 7th character of 2. Now, the definitions of your 7th character are going to vary based upon the chapter that you're in ICD-10. So let's take a look at some of the more common definitions. The 7th character extension of A is used in the injury section to define an initial encounter. And we have the reasons here which actually describe. It's really when the patient is receiving active treatment for the injury. And also, we could utilize A when an evaluation and treatment is provided by a new physician. D is for a subsequent encounter, for care that's provided after the patient has received active treatment. And here we see some examples as a cast change or removal, or perhaps some aftercare or follow-up visits. Listed here are some of the 7th character extensions from the injury section. which, by the way, has changed dramatically from ICD-9. It's greatly expanded. As mentioned earlier, the 7th character definitions will vary from chapter to chapter. For example, in the pregnancy chapter, 7th character extensions are used to identify the fetus. The next 2 slides will complete the listing of 7th character extensions for many of the codes in the injury section. As you can see, there's a lot to choose from. So remember to work with your physicians and qualified healthcare professionals to make them aware of the additional documentation required to complete the code selection. If you have any questions regarding the additional 7th character extension or how to append them, please put your questions in the comments section below. As always, remember to subscribe to Key Coding Tips to stay updated, and thank you for watching.